With us here, not only on this stage, but throughout the room, are hundreds of extraordinarily accomplished people from all over the healthcare community.
Look, just listening to what the President Trump has said out of his own mouth when he publicly asks foreign governments to dig up dirt on one of his principal political opponents. That is an impeachable offense. The fact that he does it openly and publicly doesn't insulate it from the legal consequences of breaking the law.
But I hope there'll be a day we can all work together and figure out a better solution.
How do you prioritize?
It ain't Medicare for all, because that's Medicare for none. That's going to undermine Medicare.
The values of the NBA, these American values, we are an American business, travel with us wherever we go. And one of those values is free expression.
Are you willing to absorb the possible loss that may come, financial loss that may come from this support?
Not only willing, but we are.
I was definitely noticed, a kind of rapid aging happening, in my 30s. I did go to the doctor several times and had all my blood levels checked. They were all I was malnourished, totally. And I just thought, okay, it's that. I'll get on, the proper food, vitamin. But I would have just asked for an MRI when I stopped being able to use my leg.
Would not want women to die because they don't have access to safe legal abortion either. So I think that to move the conversation forward, I hope that we can begin with these points of agreement and understand and accept the nuances and complexities while emphasizing what we all know to be true, that healthcare has to be a human right guaranteed for all and not just a privilege available only to some.
Would you change any of your health-related behaviors then? What do you look back on and said, I wish I did differently?
Yeah, I eat a lot less fried foods. My weight went up and down. I ran 20 to 25 miles a week. Normally, I never run more than about 9 miles at a time. But I was a devoted runner. And
where did that come from? Why did you become a runner?
I was in law school, and I was going with Hillary, and she said, like most things good that have happened to me since I met her, she said, I think you ought to start running. I wasn't.
23andMe, though, again, has a very clear privacy practice that it's your information. You have the opportunity to consent if you want to share it. You also have the opportunity to never share it. And so it's really the power, we're trying to give the power back to the individual to control what do they want to do with their genetic information.
When I went in for my appointment and was diagnosed with invasive cancer, I was truly, it took my breath away in horror and in oh my God, this is hilarious. Of course it wasn't hilarious, but something has to break the tension. And I was certainly on a roller coaster of emotions for quite a while.
Where we've gone over the past few years is that we've seen much more of our company shifting to how we can change people's behavior around health. How do we get people to be more active, sleep better, eat better, be more mindful? And then also more increasingly, we've been helping people manage more serious chronic disease conditions.
But the issue here is that the male-dominated professions are under-recognizing and undervaluing frontline caregivers, be they nurses, midwives, or community health workers. It turns out the math on this is pretty striking.
The truth is that now what we need to do is adapt within patients. And people say, well, that's not scientific. I said, well, then our science has to change, right, to make it patient-centered.